Hello, welcome back. Today's video will be about endocrine emergencies. So basically for the EMT, diabetes.
I'm Wilfred Brimley, and I'd like to talk to you for a few minutes about diabetes. Actually, about diabetes and you know, diabetes.
We'll be talking about the anatomy and the three different types of diabetes, physiology. So let's hop straight into it. So anatomy catered specifically for diabetic emergencies. We're going to talk about nutrients and sugar and how that all works. There are three macronutrients in the body: protein, fats, and sugars. The sugars, the glucose, we need really bad in an emergency setting. If we don't have them, we could die. Great. This is very important to understand the management of blood sugar, of sugar in general. So whenever we eat, our food is broken down into components, right? One of those components is, in fact, sugars. And these sugars will all eventually be broken down into glucose, which is the most basic sugar. That glucose hasn't been put into the right place yet, though. It's just in the bloodstream. And imagine your bloodstream as a collective of a bunch of different stuff in a fluid and some cells, right? Some of the stuff will, in fact, stay in the fluid and be processed that way, and some of the stuff has to be put into the cells and processed that way. Glucose has to be in your cells to be processed, to be used, right? So if it doesn't get there, that's very bad, and your patient could die. Yeah, you're getting good at that. How does it get in? Well, there's a bouncer. Yes, fantastic. The bouncer's name is insulin. So insulin allows the blood sugar to go down because the sugar in the blood goes down, and then it goes into the cells of the blood. So if the sugar is successfully getting from the blood into the cells, we will actually have a lower blood sugar rating. Once again, insulin is the bouncer that allows glucose, the sugar, to get from the bloodstream into the actual cells it needs to be in. So diabetes, all three types, are ways our body is malfunctioning in the production or usage of insulin to get glucose into the cells. So patients with diabetic problems often have high blood sugar, even though they don't have glucose actually getting into their cells. So you can have all the sugar in the world, but not have that sugar be processed as it should. Now, as we stated earlier, the brain can function without insulin. The glucose will still get into the brain. However, there's another problem there that we'll talk about in the third section of the video. So part 2, the three different types of diabetes. Type 1 diabetes, or also known as insulin-dependent diabetes mellitus. Just so you know, diabetes mellitus is like the full name for diabetes, and there's a bunch of different names for diabetes as it's evolved over time, but generally we call it diabetes type 1 now. Diabetes type 1 is when your body does not produce enough or any insulin. So therefore, the blood is containing all the glucose, and the glucose isn't getting into the cell because the cell does not know it needs it without the without the insulin. Type 2 diabetes is when the body is less inclined to listen to the insulin. This is usually caused by lifestyle choices. So someone eats a lot of food, they have sugars in their body all the time. The cells are like, hey, buddy, I don't care. It stops taking blood sugar into the cells. It says, this is enough. I've got so much sugar, I don't even know what to do with it. And then eventually, you don't get enough sugar into the cells on a regular basis, and then you have developed diabetes. This is why people are warned by their doctors at times that they could develop diabetes. I once myself was so obese that I was pre-diabetic, which is bad. And then type 3 diabetes, I don't think anyone calls it that, is gestational diabetes. So gestational diabetes is diabetes that could develop in someone that is pregnant. This type of diabetes is also very similar to type 2 because it is the body saying, like, I have a lot of nutrients going through here. I don't know what to do anymore, and it starts becoming insensitive to insulin. Now, it's important to note that not all people that get obese or a certain weight or a certain body fat percentage will make you diabetic type 2. That's genetics, and that's big boy doctor stuff, and that's kind of far beyond me. So those are the three types of diabetes. Let's hop into treatment. So with diabetes, you could get two calls. I'd say the more common would be hyperglycemia. Hyper meaning high, glycemia meaning sugar. So when you take the glucometer, you stick them, they're going to get a high number. We should probably define what that is. For an adult, your blood sugar should be from 80 to 120 milligrams over deciliter. in the United States. There's like a different one in Britain. You guys are on your own.
You are all wankers, and I hate this shitty place. Fuck you.
Anyway, if they're not in between that number, if they're above that number, they're hyperglycemic, right? They have too much blood sugar, and that can produce its own problems. And if they're below that number, they're hypoglycemic. They have too little blood sugar, right? So let's talk about how to treat each. For hyperglycemia, pretty simple, right? You need insulin to allow the glucose to get into the cells, right? So if you have too much glucose in the bloodstream and not enough in the cells, then you just give them insulin, and with that insulin, their cells will say, okay, I can take this glucose in, and then the blood sugar goes down, right? Now, with low blood glucose, what do you guys think we give? Glucose. With low blood glucose, with low sugar, we give them sugar, very literally. We'll give something called glucose in the emergency medicine sector. That's literally just the brand name for glucose. But you could give them anything, theoretically. The problem with giving them anything besides just glucose is that will take longer to take effect. Because remember, the body will take any sugar and eventually deduce it down to just glucose and then use that. So if you can give them glucose, that will be preferable over like Skittles, because the sugar in Skittles will have to be processed until it is once again glucose. But if you were to give them glucose, that will act faster. That is why in the emergency setting we do use glucose. However, regular sugars will have the same effect if given enough time. It's just in our field, we usually don't have that much time.
Ain't nobody got time for that.
So specifically, what goes wrong when they have high blood sugar is different for each type. For type 1 diabetes, it's diabetic ketoacidosis. So basically what's wrong is because of their diabetes, they have so much sugar in their bloodstream that ketones are produced. And ketones are another chemical that helps in digestion. And ketones are acidic, right? Now, the body has a pH level. The body has a acid-base level, a pH level of 7.35 to 7.45, right? So if you're producing a lot of ketones, which are acidic, which would mean they're under 7 on the pH scale, then your entire body will be screwed up.
Look at you, you screwed it all up again!
By your pH level. And our body depends on our pH level to be a certain level, or else we cannot survive, right? So what actually happens is with diabetic ketoacidosis, the body will have so much ketones being produced to assist with the digestions of that sugar that our pH level will go down, and that's where we start experiencing extremely adverse symptoms.
Start? I don't feel so good.
And then that's where we see brain damage. The brain damage isn't from the sugar, because the brain does pretty well with sugar management. It's the fact that the ketones are being produced to help digest that sugar, and ketones are acidic, and then our pH level comes down. Basically, the same thing happens with HHNS, which is the type 2 diabetes variant. It's a hyperglycemic problem of type 2 diabetes. Once again, type 1 and type 2 diabetes. Type 1 diabetes has diabetic ketoacidosis, which means diabetes, ketones, too much so it's acidic. Diabetes type 2 has HHNS, which I'm not even going to try and say the actual name for that or explain it. Yeah. But the treatment of them will both be the same, right? They have hyperglycemia, high blood sugar, so we're going to give them insulin or something of that sort to manage their blood sugar. So that's everything I have. Thank you very much for watching today. Let me know if you have any suggestions for future content or anything I could put in here. Please shoot the channel to your friends or anyone studying for their national. So thank you very much. Have a good day.